My wife wanted to make sure that her work and her research was going to benefit the most number of patients that it could.
She really did love what she did here, and it was important to her.
She would frequently be sought out for her expertise by people in the medical profession to help them with their own research, their own publications.
Jiajing Chen, who was a lead data scientist at Mercy, worked alongside our oncology team to predict which patients, which chemotherapy patients at Mercy were at risk of being admitted to the hospital due to factors that could be preventable if treated outside of a hospital setting or managed through a provider's office.
It can lead to better outcomes for them personally and for cancer patients as a whole.
We've now integrated with a new program that's rolled out using smart texting. Patients are sent a text in the morning asking them about their symptoms. And based off of their responses to the severity of those symptoms, they're escalated to the provider's office, which then can reach out to the patient and respond and work with the patient to try to manage those symptoms outside of the hospital setting.
Something that she worked very hard on for a long time with health databases, with data models, analytics.
Last year in the fall, Jiajing was diagnosed with an aggressive form of cancer.
She joked with me that she's become a data point in her own model now. I remember by her bedside how hard she worked to preserve as much strength as she could so that the relevant information and details were passed down, because she had such a unique skill set.
She more than ever understood what patients were going through, when going through chemotherapy and having side effects and symptoms, and the support that she needed to get through it. And it was so important to her to be able to continue this work.
She did retain that happiness of spirit right to the end, even in light of the disease that she had.
After Jiajing's passing, we knew we wanted to make sure that this was completed, and naming this model after her was really important, I think, to honor not only the work that she began, but who she was to us as a coworker at Mercy.
She had a wonderful, bright smile, and there was nothing that made her happier than being a mother. Evelyn and Ian, they didn't have the chance to know her for long.
Making sure that the work moved forward and continued in her honor was really important to us. It was important to him, so that as those kids grow up, they understand how intelligent, how wonderful, just how incredible their mother was, and how one person can make a difference in the world.